bit of an introduction. In Oxford, we've been caring for patients with sarcoma since the 70s. And in 2005, we became one of the 5 nationally commissioned centres to care for patients with primary bone sarcoma. The service in Oxford covers a population of approximately 8 million, so we've got whole of the Thames Valley area and the southwest of England. So bearing in mind, patients come a long way, as I'm sure you all know. You've all got to travel a long way to these specialist services. Due to the national commissioning, my post came in August 2005, and as of April 2009, we've also managed to get a support nurse that works with us also. So what happened prior to us being this specialist centre? So prior to 2005, there was no specialist nurse service at all. You had to come into multiple appointments for diagnostic investigation, so you could come on the Monday for an MRI, the Tuesday for a biopsy, the Wednesday for a CT, Monday 2 weeks later for an appointment, so it was just chaos. There was no constant support, no specific sarcoma patient information, and no support group. I'll get onto that a bit more later. So this is the Nuffield Orthopaedic Centre in Oxford. As you can see, it's quite a nice new building. We've been in this building for approximately 3 years. Keeps us all in one place. The NOC, that's what we're known as, the Nuffield Orthopaedic Centre, so it's not just something I've made up. So the Oxford team, as you can see, there's quite a number of us that try and ensure that all of your care is managed in a way that's appropriate and timely. We do all talk, surprisingly enough. The surgeons don't like to talk to me because I usually cause them havoc, so they tend to stay out of my way. So I'm just going to go through kind of a patient pathway for you so that I can explain what we now offer as a bone tumour service. So this is where, as you come into the hospital, this is the view that you see. The writing isn't very good, but at the bottom, that goes into outpatients, it goes into pre-assessment, and it goes into radiology, so it's all in one area. Our Monday mornings are our busy clinics, so that's where you come for your pre-diagnosis, your diagnosis and your follow-up. It's a one-stop clinic now. We can get you in and organise your scans and your biopsies on that day. The only scans we can't organise on the day is CT scans because we don't have a CT scanner. Okay, so that takes me a couple more days to organise that. You'll obviously see one of the consultants that's going to be looking after you and meet myself and Pippa. Excuse the picture, somebody had to be in it. So basically the diagnosis, I know, great uniform as well, isn't it? So the diagnosis is given obviously with the consultant and one of us nurses is present. Okay, so you don't just get your diagnosis and walk out the room. You get your diagnosis and then unfortunately you're stuck with myself or Pippa for at least half an hour to go through information with you. Pip and myself have worked together to produce patient information, as you can see here. And the reason you may think, why have we got the sunflowers? But at the front of our hospital, they put up these massive metal sunflowers. Don't ask me why, but we thought that they'd look pretty on the information. And we also work with you guys to decide what you want in the information, what information do you actually want and need. So it's not just Pippa and myself thinking, actually, we know what you need, so we'll do it. We work closely with our patients and families and other staff. So if you need chemotherapy, radiotherapy in your treatment pathway, this will be done at the Oxford Cancer Centre, which is actually based at the Churchill Hospital in Oxford. This is also a fairly new building. As you can see, it's not so pretty, but you know, it's fine. It's useful and it does everything you need it to do. And what we have here are 2 consultant oncologists who are based at the Churchill. These are adult consultant oncologists. The paediatrics are based at the Children's Hospital in Oxford. And they work closely with us as part of the MDT. The majority of the surgery is actually undertaken with us at the Nuffield Orthopaedic Centre. And surgery can also be joint cases, as I'm sure you are all aware, with the plastic surgeons. and it's very much an MDT discussion as to what needs to be done. But the paediatric surgery and any chest surgery that's needed is undertaken at the Oxford Radcliffe hospitals. Okay, you may think there's a lot of hospitals going on here. Yes, there are, but they are actually very close together. Okay, which is good because it means I don't have to walk so far between the two. So, if you're lucky enough to come into the NOC for your surgery, all of our patients with sarcoma are nursed on one ward, which is Ward F. This is Vicky, our ward sister, and the majority of the staff have now undertaken some sort of cancer training. Prior to 2005, that wasn't the case. And myself and Pip are majority of the time on the ward, but if you can't find us on the ward, our office is literally right outside, so you can't miss us. So once you've had your biopsy, we come back to a 2-week follow-up for final histology and plan. And also at that appointment, if you do need to be seen by the oncologist, they are in clinic with us. Okay, so on a Monday morning, you've got the surgeons, the oncologists, the radiologists that we need, CNSs, we're all there. So the follow-up that we do in Oxford, you're probably all quite used to this. 3 monthly for the first 2 years, 6 monthly years 2 to 5, and annually from years 5 to 10. We undertake a baseline MRI at 3 months following treatment. Obviously, chest X-rays are undertaken at every clinic appointment, and your chest CTs as required, and we can work with the Churchill quite closely to plan those for you. Well, I say recently, probably about 18 months ago now, we decided that the patients and families that were in long-term follow-up, so say you're coming annually just for your chest X-ray and just for your examination, a Monday morning clinic was chaos. You would get there, you'd sit there for an hour, then somebody would decide to send you for an X-ray, and then you'd sit an X-ray for an hour, and then you'd come back and you'd see the consultant or the registrar for 5 minutes, and then you'd be sent home again. And a lot of people found that very frustrating. So we decided that I would run a nurse-led follow-up clinic for any patients who are post 2 years from their treatments. This is on a Friday morning. Parking is much easier because people like to have long weekends and they seem to take a Friday. Not quite sure how I haven't got in on that game, but there you go. So Friday mornings you come in, your X-ray cards are waiting for you, you don't even hit the chair, you go for your X-ray, you come back, and I'll see you. If people are concerned that, oh, it's a nurse, it's not a doctor, any concerns that anybody has, if you need to be straight back into the consultant's clinic, that's something that we can do. That's not a problem. It's not you're with Helen and the doctors are never going to see you again, although some people might prefer that, who knows. So it's a lot quicker, it's less stressful, and it also gives people the opportunity to discuss other things, finances, problems, work problems, things that you wouldn't necessarily get into with your consultant. Maybe you would. So, how many of you that have been in a sarcoma service have been asked your views in a patient satisfaction survey? Hands up. One. Okay. Doesn't surprise me. So basically what we do in Oxford is yearly we send out a patient satisfaction survey, okay? And it's because of the views and comments that I've got back from this, that's what's been allowed me to take on and to move the service forward and make things better for our patients and families. And actually your voice is much more powerful than me saying to the chief exec, I want. Okay, if I can say my patients say we need, they take notice of that because it's not me. Okay, so remember that. We did start a support group, which is set up once a month at the NOC. Everybody's welcome, but it isn't well attended. Okay, it did start to be right at the beginning, but it's fizzled out. We can't work out if it's because people have to come a long way, because people expected everybody to have the same disease and have had the same treatment. We're not quite sure exactly why that kind of diminished. I sit there once a month waiting for people to come and say hello, and they don't. So what we're looking at now is some sort of an online forum so that people don't actually have to come physically and sit in a room with me and other people, but it's down to funding, so we'll just skip over that at the moment. So what other things do we do in Oxford? Obviously Sarcoma Awareness Week. We also did a cake store. I didn't cook them. I can't cook. You'll be happy to know my mum did. So everybody was safe. We had these two of our bone cancer patients who came in. We got the local newspapers in, all enabled us to try to raise the awareness of sarcoma, because we all know that people take way too long to get to us, and so the more we can get out there and shout about sarcoma, the better. We also had a sarcoma stand in the main hospital atrium, which appeared to go down quite well. You do need to be careful when doing things like this though, because I then saw a lady in clinic who'd got a totally benign condition who freaked out because I'd got my Macmillan badge on and we'd got a cancer stall outside, so you just have to be a little bit careful. And I also went on the local radio to try and, people that know me will know if you start me off about sarcoma, you can't shut me up, okay? I'll keep going. And so they think they just switched the off button at one point and cut me out. So I was nominated for the Nursing Times Cancer Nurse Leader of the Year because of the changes we've been able to make to our service in Oxford. And I did go on to win that. Most of you will go, how? And I'll say, I don't know. But it was very nice. And it's very nice actually to have a title like this in such a rare cancer group. So I was very proud to win it. I'm very proud to bring it back to Oxford and to sarcoma care in general. So we very much work with yourselves to try and make the changes that you need, that you feel need to be made to what we're currently doing. We're constantly changing. We always want to do things for the better for you guys. As I say, just because I say it needs to be done doesn't mean it's right. And so for you guys to have involvement in these services is fantastic, so that we can change things and improve things for you. Any questions? No. Good.